Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers and clients, and the question last week was: the ICU team is thinking negative about my dad's condition. How do we deal with it? You can check out last week's question by clicking on the link below this video. In today's episode of Your Questions Answered, I want to answer a question from one of my clients, Anna, as part of my one-on-one consulting and advocacy service. Anna's dad is in ICU and the ICU team won't give her a copy of her dad's CT brain scan. Anna is therefore asking if she could challenge the ICU team and push for what she wants. So today's question is: the ICU team won't give me a copy of my dad's CT brain scan report. Should I challenge the ICU team and push for what I want? So these are excerpts from consulting and advocacy options that I'm going to read out now between Anna and myself. Hi Anna, thank you for the update. A couple of things. It's great that you keep pointing out what your dad wants. Please have a listen to this interview. Here I put actually a link to a podcast in the written version of this blog below this video. It's a very good podcast with one of our other clients that survived against many odds in ICU. The podcast is to give you more perspective. You may also be interested in services like intensive care at home. Those services are not operational in the UK yet, but have been operational for many years now in other countries such as Australia, Germany, and they are a genuine alternative to a long-term stay in ICU, and I believe your dad would greatly benefit from it. You also need to ignore the doom and gloom for now. Intensive care professionals are the expert when it comes to intensive care, not when it comes to life after intensive care. Stay positive no matter the outcome. Easier said than done, I know, but again, you need to stay positive. It beats the alternative, staying negative. Let me know when you want to talk. You can always book an hour consultation with me here, but I can be flexible around timing. Just let me know. Anna writes, hi Patrick, that's very helpful, thank you. Unfortunately, we've been told they won't give us the copy of the CT brain scan due to patient confidentiality and that there isn't a consolidated report that they can provide anyway. Does this make sense to you? I do want to go ahead and book our chat, but if you think I should challenge it, I'd be very grateful for guidance and advice from Anna. Here's my response. Hi Anna, whoever is the medical power of attorney or next of kin for your dad has every right to get access to the medical records or the report under the Freedom of Information Act. You could also get consent from your dad himself to get the report. It sounds like your dad might be in a position to authorize this by now. This is a whole lot of crap they're telling you anyway and are just delay tactics. What do they have to hide? If they haven't got anything to hide, they should be able to give you the medical records in no time. As I have mentioned to you before, if you don't succeed at first, keep trying. Those are just delay tactics and they can't stop you from accessing the report. You might have to change tact slightly and get a bit more forceful. You might have to mention that you will use a lawyer or a solicitor to get access to the medical records, and you will see that they will respond to that and give you access to the medical records. I have never ever worked with a family who can't get access to the medical records. Whatever they tell you is crap. Just keep requesting the medical records with a deadline. Looking forward to talk to you. So here's Anna's response. Hi Patrick, many thanks for your email. That's very helpful. I will ask my stepmom if she can request when we visit next. She is the recorded next of kin for my dad. They're saying Dad doesn't respond to commands and that his limbs moving are just reflexes. Dad doesn't really respond much at all to the nursing staff, and if he does, not consistently. His biggest response is to his family. He will appear to kind of follow a conversation, do a silent laugh or a smile or nod to a simple question. Is it comfortable? But that's the extent of it. He doesn't seem able to focus his eyes at all. The consultant says he looks vacant, not cognitive. He said those responses our family observe are very basic and should have progressed to more by now. I have asked to have a discussion with the consultant neurologist myself, since they're not planning to bring a neurologist in to assess Dad despite our requests. They agreed to arrange it for me for later in the week. We feel it's incumbent upon the ICU to demonstrate to us beyond reasonable doubt that Dad is brain damaged and that his prospect of neurological recovery is minimal. Otherwise, we feel they're asking us to support withdrawing life support on uncertain grounds. Would it be possible to speak tomorrow at 10 a.m. UK time or thereabouts? My brother would be able to listen to the conversation as well and contribute. Obviously, I understand if this isn't possible. From Anna. Hi Anna, tomorrow at 10 a.m. UK time is fine. Please also find out what medications your dad is on. There may be some medications in the mix keeping him drowsy. Just like with a CT scan, get all the information you want substantiated and information. Don't give them any reason to not back up what they say beyond the shadow of a doubt. I would go as far as that you or your stepmom should get all the medical records. Again, that's no problem and you are entitled to it. I have never worked with a client who couldn't get access to the medical records. I'll give you a call at 10 a.m. your time tomorrow. From Anna. Hi Patrick, thank you for your email. I'm hoping my brother was able to get a picture of the ventilator settings and to ask what medications Dad is on. I will forward to you as soon as possible. My stepmom reported yesterday that as she arrived, his nurse said, your husband is doing better neurologically today. He was sitting in the chair and my stepmom and his sister spent a few hours with him. They felt he was interacting, laughing, smiling, nodding. On Saturday, as you know, I asked the consultant again for an assessment by a neurologist. When he effectively declined, I said, okay, could I meet with a neurologist myself? As I have lots of questions and I'd really appreciate getting an understanding of Dad's condition for my own benefit. He agreed. I gave my availability for the end of this week. Yesterday, a matron greeted my stepmom on arrival. It was thought it would be helpful to assign me to your husband's case, to be here for you as a family and put forward, answer any questions you have. She took the trouble to assure my stepmom there was no question of needing Dad's bed. We had one patient in ICU for a year, she told my stepmom as they talked. What an interesting development, Patrick. It was also passed on to me via my stepmom that the consultant neurologist was available to meet me on Friday, but that, guess what? He will come and see Dad to review him. I suspect they won't let us meet with him alone now. They will include an ICU consultant to give, quote unquote, their perspective. It's gone from me requesting a one-on-one meeting to a neurological assessment, but that's good, the outcome we wanted. It will be clear about Dad's wishes as we discussed. I will also be clear that we had always wanted and asked for a neurological assessment to be part of his diagnosis and treatment plan from the beginning, and that our position remains the same. The fact that this meeting is happening in week 7 will tell the neurologist what he needs to know. I am hoping he can talk to us through the CT brain scan report as well. I'll get the medication list and ventilator stats to you as soon as possible. I suppose we will have to wait and see what the neurologist tells us and go from there. Thank you. From Anna. Here is my response. Hi Anna, that's great news, well done. They know you won't be giving up, nor will you take no for an answer. Keep pushing for what you want. I'm looking forward to hear from your brother. This is from Anna. Hi Patrick, my brother took the photos today but apologized for the blurry focus. He took it quickly and then later realized it could have been much clearer. My apologies. It said PEEP on one of the monitors. I've not seen his saturations levels at 88 for a while. Apparently that was when they first put him in the chair, then it went back up. They're usually 92 to 95%, on occasion higher. I've seen them at 96 or 97% when he coughs and they suction. It goes up to 92 to 95% or higher. I've seen them at 95, 96. When he coughs and they suction, it goes up to 100% momentarily. They managed 25 minutes off the ventilator today. They put the television on for Dad. he enjoyed watching the World Cup. My brother and stepmom said Dad was able to squeeze their hand on request today and nodded, shook head to questions. I will chase up what medications he's on. Do let me know if the images are no good and I'll take some myself when I travel there on Thursday. Best wishes from Anna. Here is my response. Hi Anna, thank you. I can actually see the pictures below. I didn't realize the pictures were in the mail. Here is the following regarding ventilation. Your dad is in a spontaneous ventilation mode, CPAP or pressure support ventilation. This means he's breathing spontaneously where he has to trigger every single breath and get support from the ventilator. That means he's in a ventilation mode where he's very close to coming off the ventilator. My concern is that he's still on 35% oxygen. Ideally, it should be 30% or less. Furthermore, his breathing rate is too fast at 47 breaths per minute. It should be less than 30 breaths per minute. His breathing volumes look adequate and his oxygenation on the monitor is 88% and it should be 92%. You should be asking for his arterial blood gas results, his CO2 levels in particular with COPD. So overall, your dad might be close to coming off the ventilator, which is great news. Please let me know if any medications he's on so I can comment. Here is Anna's response. Hi Patrick, thanks so much. Our plan is to purchase another hour talk with you once we have the meeting with the neurologist. Dad seems to be doing better neurologically. They are now talking about doing surgery to fit Dad's pacemaker internally. Would it be okay if I ask a few questions regarding your comments below on the ventilator? My concern is that he's still on 35% oxygen. Ideally, it should be 30% or less. Furthermore, his breathing rate is too fast at 47 breaths per minute. It should be less than 30 breaths per minute. Sorry, Patrick, do you mean they should be adjusting the settings, or is your concern that Dad is struggling with oxygen and breathing? Apologies if I'm not understanding you correctly. His breathing volumes look adequate and his oxygenation on the monitor is 88% and it should be 92%. You should be asking for his arterial blood gas results, his CO2 levels in particular with COPD. I will ask for the blood gas results. Thank you. I think I mentioned when my brother took this snapshot, they had just moved him into the chair and adjusted his settings. Then his saturation levels went back up to 92%. Many thanks as always. So that's the last email for today. So how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of our website. Have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me over the phone, via Skype, via email, via Zoom, by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.